recent C-section, you might be wondering how to heal your scar and feel like yourself again. In today's video, I'll be telling you everything about scar tissue recovery for C-section surgeries, when to start, what to do, and how you can do it safely at home. These simple techniques will help you improve mobility, reduce pain and discomfort, and even minimize the appearance of your scars. Hi mamas, and welcome back to my channel. If you're new here, hi, my name is Shridi. I'm a board certified physical therapist helping postpartum moms just like you regain their core strength, heal their pelvic floor, and improve nutrition all in 15 minutes a day. So let's get started with today's video. After your C-section surgery, your body works really hard to help you with healing and recovery. However, scar tissue behind those incisions can slow down your recovery. Scar tissue can cause tightness in the area, pain, limits your movement, and also causes some discomfort every time you try to bend down. So gentle massage will help improve the blood circulation to that area, healing your scar tissue and helping you restore your normal movement. So we will be using castor oil for all the massage techniques today. If you don't have castor oil, you can always use some unscented lotion, but I highly recommend using castor oil because it is proven to work effectively for scar tissue healing. First things first, before we even get started with any scar tissue work, you need to get clearance from your doctor. Usually you can start doing scar tissue mobilization after 6 weeks of surgery. However, sometimes your scar can take, the incision can take longer to heal. So you want to make sure that you get clearance from your doctor that it is okay for you to do some scar tissue massage over your incision area. So once you have an okay from your doctor, you can get started. I want you to go ahead and get seated in a comfortable position. Have some oil or lotion handy so you can put that on your fingers. So the first thing we're going to work on is warming up the skin. So what I want you to do is go ahead and take that scar area, and then we're going to take some oil on 2 fingers and then gently just rub it over your fingers and thumb. Now what I want you to do is just with 2 fingers, you'll start on one side, and I want you to gently go in a back and forth motion where we are just warming up the skin. Good work. Now slowly you're going to make some progress, and we're going to cover the whole length. Good, slow and controlled. Now if you feel that you're having a lot of friction, you can always use more oil. Put it on as needed. Gently warm up those fingers, and then I want you to continue just using 2 fingers. We're not putting any pressure yet. We're just gently massaging, warming up the skin. Nice work. Good. Now make sure you're doing this very gently. I don't want you to be rubbing against the skin too hard. This is just warming up the skin and the incision area, slow and controlled. Nice work. Now once you have covered the entire length of your incision with 2 fingers warming up the area, next one we'll work on is 2 fingers and a thumb. I want you to work on lifting up the skin and then gently moving it up and down. Nice work. Slow and controlled. Again, we're doing this real gentle. We don't want to put any extra pressure, or we're not trying to pull anything. We just want to lift that area and then just move it slowly. So you lift and you move. You lift and you move. Nice work. Slow and controlled. Now once you get to the end, we're going to repeat the same thing, going back to the starting position. Good. 2 fingers and a thumb. We're lifting the skin, so we're trying to lift up the scar tissue under, and then moving, so we're breaking up the scar tissue underneath your skin. Nice work. Slow and controlled. Good. This whole process should take about 3 minutes, at most 5 minutes. However, the goal is at the end of the session, you want to feel your skin loosening up and the tightness is less than before. Good. We'll do this one more time, slow and controlled. Again, remember, if you start feeling a lot of friction, feel free to grab some more oil and put it on your fingers as you work through this area. Nice work, slow and controlled. And I really want you to feel for what is underneath your skin. There will be areas where you will feel more tightness than the rest. So that's the area you want to focus on more. Maybe doing it a couple times extra in that area. So make sure you're not just doing this for the sake of doing it, but really feel what is underneath the skin. Where do you feel more tightness? Where do you feel a heaviness? Good work. Awesome. Now once we're done with that, we're gonna go ahead and take on a little more lotion. And this time we're gonna really rub it on the thumbs. Perfect. Now what I want you to work on is, you can even use your fingers, whatever is easier, but I really want you to gently make circles now. So we start in one direction, nice work. And then we want to gently make circles. Again, we're not putting any pressure, just gently, we're making circles, trying to increase the movement. Now if you get to a certain area where thumb is harder, you can continue with your fingers. Make circles, working through the length of your scar or your incision. Nice work. And then now we'll come back. You can change the direction of the circles or you can keep the same. It doesn't matter. But slow and controlled, we want to move it. Come back to the starting point. Nice work. Let's do this one more time, back and forth, slow and controlled. Good work. Slow and controlled. Make sure you're feeling for what's underneath the skin. Any areas that feel more tender or more tight, you want to focus on that area a little more, because it is probable that you have more scar tissue built up under that particular section of your skin. Good work. And now for your last one, what we're going to work on is we're going to take 2 fingers and we're going to rub them against like this, going through the length of your incision. So we're going to have 2 fingers right here, and then we are going to go up and down. Nice work. And now I want you to go ahead and put just a little pressure, not too much. And if you cannot tolerate pressure, if it feels very sensitive, that's totally fine. Don't put pressure, just put your fingers on the incision and then move the fingers up and down, going across the length of your incision. And eventually, once you practice this more, you'll notice your sensitivity starts going down and you will be able to tolerate a little more pressure. But right now, if it's your first day trying this, don't worry about putting a lot of pressure. Just work through the incision, doing these movements. So we're warming up the area, we're starting to loosen up the scar tissue, and then over time, once you're consistent with this, it will get easier, less sensitivity, and you'll be able to tolerate more pressure. We're gonna go ahead and do this one more time. Along that incision line, you're going up and down. Nice work. This is the last thing. So we start with warming up, then we lift up the skin, then we do small circular movements, and then the last one is cross massage, where we're going along the perpendicular to the incision, we're moving up and down. Nice work. And relax. Now while doing this, if you start noticing redness, swelling, or increased pain, I want you to stop immediately and consult your doctor or see a physical therapist, and they can guide you on how to do this effectively and safely, because sometimes you could be putting more pressure or you are not doing it correctly, which can cause those symptoms to pop up. So stop immediately and talk to a professional who can guide you through how to do it safely. That's all for today. I really hope you found this video helpful and you can implement these massage techniques so you can start seeing results sooner. Your scar will start feeling lighter, you can move better, you'll have less discomfort. So definitely give this a try. And if you did like the video, make sure to hit the like button and subscribe so you are always updated when I post a new video on this channel. Take care, mamas. Bye.